I want to talk about why it's a bad idea to blame users for mistakes that they make while using products that we might be working with. Hey there, thanks for joining the Research Collective YouTube channel. I'm Bryant Foster. If you're involved in designing products, you know just how difficult it is to design a product that is both useful and usable. For medical devices, usable often equates to safe. One of the great things about medical device human factors is that regulatory agencies around the world have recognized its importance as a way to reduce patient harm and have published documents to standardize the design process device manufacturers should follow. Usability testing is a human factors and user experience research method designed to evaluate a product's ability to be used correctly by its intended users. I think it's worth making a special note that the purpose of usability testing is not to determine if intended users can use the product as intended. Although the two definitions are nearly identical, the former keeps the focus of the evaluation on the product, where the latter implies that the intended users, or the study participants, are the subject of the test. Study participants should represent a sample of the population of the people intended to use the product. It should be expected, even celebrated, that they come in all shapes and sizes with varied abilities, limitations, life experiences, strengths, and weaknesses. Participants that use the product correctly, they refer to the instructions when they get confused, they answer our questions accurately, they're not good participants. They are simply participants. Participants that toss the instructions in the garbage, make mistake after mistake, and they don't notice the bolded, highlighted, circled warnings that we work so hard to put on the box. These participants are not bad participants. They are simply participants. Both types of participants provide valuable information regarding the quality of the product's design. If we were evaluating people, we would obviously say that the participants that did everything correctly were better. That would be fair. However, we are not and will never evaluate people in a usability study. It's important to ensure the subject of the usability study always remains the product design, not the people who are coming in to help us evaluate the product. I know how easy it is to allow participant blaming to creep into the study observation room or while we're going through the results after the study's over. I mean, after all, participants will often blame themselves for errors that they made along the way. When analyzing your study results to determine the potential root causes of any use-related issues that you might have observed, always consider first the likelihood of a shortcoming in the design of the product before attributing blame to the user. If you find that you've listed a user-focused root cause of an error, meaning that it blames the user, consider asking yourself if there's anything at all the product could have done to prevent that error from happening. You need to remember we're evaluating products, not people. Use errors, difficulties, close calls, near misses, etc. are the result of a flaw in the design of the product. If we want to have a shot at truly making a usable product, we cannot afford to blame participants for the errors they make in usability studies. Thanks for watching. Again, I'm Bryant. Until next time.